This is a note for an established office patient. It contains 159 words. To figure out what it's worth, we need to figure out the level of care by taking apart the history, the exam, and the medical decision-making, and plugging it into this table, which shows the documentation requirements for established office patients. For these encounters, only 2 out of 3 key components are needed. You can use either the 95 or the 97 guidelines. In this case, the 97 rules work out best for the doctor. Starting with the history, this is the table we use to figure out what level of history has been recorded. Here we have a valid chief complaint. Then, looking at the HPI, the doctor states the patient's proteinuria continues to worsen despite ARB ACE inhibitor therapy. CKD, which is due to biopsy-proven membranous nephropathy, has also worsened, with GFR now down to 33 mL per minute. Hypertension is finally controlled with systolic pressures running in the 120s. So using the 1997 guidelines, we see here we've commented on the status of 3 chronic problems. That means this would qualify as an extended HPI. The next step is to figure out the PFSH. Looking at the PFSH, here the doctor refers to a previously dictated note. Both the 1995 and 1997 guidelines do state that a previous ROS and PFSH can be recycled as long as you update the information and note the date and location of the note you're referring to. For the sake of this example, let's assume that the previous note did indeed contain a complete PFSH and also a complete review of systems. So going back to our table, now we know we have an extended HPI, 3 out of 3 components of past medical, family, and social history, and a complete review of systems. Therefore, we have a comprehensive history, so the first key component is now known. The next step is to check the physical exam. Looking at the exam and using the 1997 E&M guidelines, here we get 1 bullet for recording 3 vital signs, 1 bullet for listening to the lungs, 1 bullet for listening to the heart, and 1 for looking at the lower extremities for edema. This gives us a total of 4 bullets, which means we only have a problem-focused physical exam. The next step is to check the medical decision-making. Looking at the medical decision-making, and starting with the problem points, here the CKD is worth 2 points because it's an established problem which is worsening. Same goes for the proteinuria, 2 points for an established problem which is worsening or not controlled. The hypertension is stable, so that's worth 1 point. That gives us a total of 5 problem points. The next step is to check the data points. Looking at the data points, all we did here was review and/or order labs, which means we only get 1 data point. The next step is to check the risk. Looking at the risk, the relevant part of the risk table is the high risk part, because here we're starting the patient on Cytoxan, which definitely requires close monitoring for toxicity. So this is definitely a high risk encounter. So now we know we have high risk. So we have 4 or more problem points, 1 data point, and high risk, which means that since only 2 out of 3 dimensions are needed, this adds up to high complexity medical decision-making. So the final key component is now known. Going back to our documentation grid, now we know we have a comprehensive history, a problem-focused physical exam, and high complexity medical decision-making. And remember, for these encounters, only 2 out of 3 key components are needed, which means this adds up to the 99215 level of care, otherwise known as the level 5 established office visit. When you put it all together, this is how the final note looks. Remember, 2 out of 3 key components are needed, and here we have a qualifying history, a non-qualifying physical exam, and qualifying medical decision-making. So here the 99215 level of care took us 159 words to construct, and it's worth $133, which works out to 83 cents per word. If you want to learn how to take apart a note like this, consider signing up for one of our web-based E&M coding curriculums. We offer several different subscription options to match any practice pattern. We also have a CODA curriculum, which includes up to 33 AAPC CEUs for only $99. If you need E&M coding education from multiple providers, ask about an E&M compliance web portal, which provides trackable and verifiable E&M coding education for multiple doctors.